Good evening. Tonight is the Ask Me Anything June edition for Dr. Twyman. So we'll get started in just a minute. Thank you for those who submitted questions ahead of time, and wait for a few more people to log on. If you have a question you want to talk about it tonight, just drop it in the comments and we'll try to get to it. So this weekend gave a fascinating talk on how the heart really runs on light. Gave it for the Quantum Health Summit. For those that you attended, it was a fascinating conference. So, there was just a one-time play, but I believe you can sign up for replays. There might be a small fee to do that, but if you go to circadianlife.tv, you should be able to find the replays on that. But you have a talk on how the heart is more than just a pump. The heart is a muscle filled with mitochondria, and mitochondria respond to the light environments that are sensed by it. So, give a talk about how mostly photobiomodulation affects cardiovascular health. Small trials showing it reduces heart attack size. Showed people how to properly interpret studies and look for what parameters they need to use to treat themselves with photobiomodulation. So, if you want more information about that, I do have my own kind of dedicated site, redlightdoc.com, that goes over that. A few different videos that go through different gear that I've used in the past and different areas of treatment. Tomorrow night, I'm going to be actually talking for a company called Calroy, talking about their product called the Arterosil, which helps with the endothelial glycocalyx. It's more geared towards people who've never heard of the glycocalyx, which is the gel coat lining the arteries. I'm going to be talking about the 5 favorite tests that I use to assess people's endothelial health. If you've seen me in the office before, we do the max pulse, which looks at the pulse wave velocity, how elastic or how stiff your arteries are. It's a little finger probe. We do the ACCOR blood pressure, which looks at the central aortic blood pressures. We also look at the EndoPAD in some cases. That gives you the percentage of nitric oxide production from the brachial artery. We look at carotid intimal medial thickness testing, looks at the thickness of the wall artery on the side of your neck, which tells you essentially how fast your arteries are aging, gives you a vascular age. Also gives you, if there's any plaque in the arteries, how much plaque is present. And then also for patients over 40 who've not previously had events, so no heart attacks, no strokes, no bypass surgery, generally recommend a test called the CT coronary calcium score. It's a low-dose radiation scan that looks for calcifications in your arteries. Calcium is supposed to only be in your bones and teeth, not supposed to be in artery walls. If it's in your artery walls, it's a marker that there's plaque building up in your artery walls. So I'm going to go over that with this audience tomorrow night. So if you're interested, it's a free seminar. I'll put a link in my stories after this IG Live is done. So we'll get to the questions. Welcome everybody. We're doing the Ask Me Anything tonight. So if you have any questions, just drop them in the comments. But I'm going to start with the ones that got put up ahead of time. So, all right. So somebody's asking a question, can somebody correct atrial fibrillation without surgery or ablation? So it depends by what you mean by correct, but atrial fibrillation is an abnormal heart rhythm. So you have a top chamber of the heart called the atria, the bottom chamber of the heart called the ventricle. Atrial fibrillation starts in that top chamber and it has a very irregular pattern. So atrial fibrillation happens when the atria is beating 300, 400 beats a minute. The bottom chamber of the ventricle can't beat that fast, so it blocks most of those messages. But that chaotic rhythm can cause clotting to happen in the atria. And if those clots break free from the atria, that can induce a stroke. So that's the major risk of atrial fibrillation. There's different types of atrial fibrillation. There's paroxysmal, where people go in and out of it. There's persistent, where they're in it unless you give them a medication or electrically cardioverted and shock them out of it. And there's people who are in permanent atrial fibrillation, either because they've decided they don't want treatment to get out of atrial fibrillation, or they failed previous ablation surgeries or different medications to try to keep them out of atrial fibrillation. So it depends on what type of atrial fibrillation they have. And then also it's atrial fibrillation begets atrial fibrillation. So the longer you're in atrial fibrillation, the longer you're likely to stay in atrial fibrillation. So first thing you address is, what is that person's stroke risk, and discuss anticoagulation plus minuses for that person. Then you got to decide, is it a rate control strategy or a rhythm control strategy? Some people have no concept that they're in atrial fibrillation. So they can say, 6 p.m., I'm in AFib. Oh, it's 6:20, I'm out of AFib. They generally may feel their heart racing, short of breath, chest discomfort, just feel funny. Other people have no concept that they're in it. So first, got to see, like, if you're very symptomatic, then procedures are a little bit more likely to help you just for quality of life. But the atria, they're kind of canaries in the coal mine. They're just sensing what's going on in the environment. So they're very sensitive to electromagnetic frequencies. They're very sensitive to infections, very sensitive to inflammation. So there's different biomarkers, labs that you can check to see, what might potentially contribute to the atrial fibrillation. So if your thyroid is overactive, if your electrolytes are out of balance. So if you find something that's reversible, you don't need a procedure. And so, welcome. So somebody says that they're completely new to my page. What is the #1 way to reduce plaque deposits? Have healthy levels of nitric oxide. So nitric oxide is a short timed gas that's released from the endothelium. The endothelium is the inner lining of your arteries. That nitric oxide does two things for the blood vessels, which you have 60,000 miles of. The nitric oxide causes the muscle and the artery to relax. That improves blood flow. That keeps blood pressure under control. But nitric oxide also acts like non-stick surfaces. So when there's high levels of nitric oxide, whatever's floating through the blood doesn't stick to the artery wall. So if you have low levels of nitric oxide, you will eventually develop something called endothelial dysfunction. If the endothelium is dysfunctional for long periods of time, you're much more likely to develop plaque in the arteries. So the #1 thing to reduce plaque deposits is to keep healthy levels of nitric oxide in your arteries. And I've done videos on that in the past on how to optimize it, but the short story is get your skin in the game. When UVA sunlight hits your skin, nitric oxide is liberated from the artery walls. When you exercise, you will make nitric oxide as the blood flowing across the endothelial calyx will induce the endothelium to release nitric oxide. When you eat your beets and greens, those get dissolved in your saliva, convert from nitrates to nitrites. You swallow it, it goes into your stomach. The stomach acid will ultimately convert it over to nitric oxide. So therefore, you got to have healthy bacteria in your saliva. So you do not want to be using the antistringic and antibacterial mouthwashes. Those things will affect the bacteria in your saliva the way they can convert the nitrates into nitrites. And you need to talk to your doctor if you're on any type of acid blocking medicine. So if you're on one of the proton pump inhibitors long term, if you've had a recent ulcer or just very high risk of bleeding, you can't just stop these medicines on their own. You need to talk to your doctor about it. But if you're on an acid blocking medicine, your body doesn't make the same enzymes in the stomach. So you're not going to be able to make nitric oxide as efficiently. Without acid in your stomach, you don't digest your proteins as efficiently. So talk to your doctor if you need to be on that proton pump inhibitor for long periods of time. So I don't know exactly what this question is about, but I'll try to answer it one of two ways. So they want to know more about, I don't know what the Spectra watch. I have a watch called a Spectra watch, but it doesn't seem to fit in this place. But if you're asking about my Spectra watch, that's a photobiomodulation watch that sits on your wrist and puts the healing photons of light directly into your radial artery that runs along the side of your wrist. The Spectra watch is really good for when you're coming down with a cold, helps with jet lag, just energy boost, musculoskeletal injuries. It can be beneficial for it, but not necessarily useful to treat diabetes or cholesterol with that watch. But if you're saying, what do you expect you should be watching for somebody who's got diabetes or cholesterol medicines and statins, that's going to require a comprehensive type of look at the health of the arteries, because yes, I care what's floating in your blood, but I care what the arteries are doing with that biochemistry. So we look at the elasticity of the arteries, we look at nitric oxide levels, we look at your central blood pressure, and then we look at very advanced blood work, looking at inflammation, oxidative stress. We look at the lipoproteins that actually channel the cholesterol around the system. Diabetes is more than just having a high hemoglobin A1C. You're going to tend to have high levels of lipoproteins, high levels of small LDL, potentially oxidized LDL, more likely to have a lot of inflammation, high insulin levels. High insulin is very detrimental to the endothelial glycocalyx. It damages it, gives it a haircut. You don't make as much nitric oxide. It's one of the reasons why diabetes and prediabetes can drive hypertension or high blood pressure, because you get lower levels of nitric oxide. Somebody's commenting on my nice glasses. Yeah, these are just one of my many pairs. I tend to like to wear these ones with IG Live and during the daytime when I'm on my laptop. These are my day pair. These will block up to, I believe, 465 nanometers. If I'm wrong on that, it's 450. So they're going to be at least somewhat yellow. Tend to block at least 40% of the high intensity blue light. So it just helps with eye fatigue, but I'm trying to protect my melanopsin receptors in the back of my retina so that I will have optimal sleep tonight. Generally about an hour or so before bed, I'll switch to the darker red tinted lenses. These are my EMR Tech Wolverines. I just think they kind of look badass, so I tend to like to wear these ones more often. And there's the Quantum Health TV gang. Welcome. Just talked about the great conference we had this weekend. If people are interested in learning more about that, Quantum Health TV, you might be able to still potentially sign up, and I don't remember exactly what the fee is if you want to watch one of the replays, but if you want to watch some excellent speakers on quantum biology, go to their website. And then there's a question I sometimes get asked. Do I take any particular medical insurances in my practice? My practice, Apollo Cardiology, is out of network for all medical insurances. That was the best way for me to be able to work directly for the patient. I don't answer to anybody else, no insurance companies, drug companies, hospital systems. I answer just to the patient. That being said, patients are free to use the medical insurance for any type of testing that's done outside my office. The blood work is generally covered by most people's medical insurance. You're provided with an invoice/super bill at the time of your visit, and you can submit that to your insurance if you have any out-of-network benefits. If you have an out-of-network benefit, your insurance company would directly reimburse you then. All right. So I think I just knocked through the pre-written questions. I'll double check to see if there's any ones that are coming in when I've been chatting. All right. All right. Well, we'll give it another minute or two, see if any other questions come in. But I was mentioning earlier, for those who are just logging on, I'm doing another webinar tomorrow night for a company named Calroy. I'm going to be talking about the endothelial glycocalyx, talking about the top 5 devices that I use in my current practice to look at the health of your arteries. It's a free seminar. It's geared more towards medical professionals, but if you're interested, I will put a link in my stories when I'm done chatting, and you guys can check that out then. All right. So somebody's asking me, what is the best supplements to take for your heart? This is a question I cannot answer, for a global audience. It, as always, depends. I very much do precision medicine. I look at what you're potentially deficient in. What is your mitochondria haplotype? How healthy are you right now? What are you, health goals are. So there is no particular supplement I recommend to everybody other than natural sunlight. So if you're interested in really having me fine-tune medication or supplement regimen, it's best to work with me in my practice at Apollo Cardiology. Best foods to eat for the heart health, omega-3s would be high on the list. Getting high-quality protein every day to feed your muscles. Your muscles are extremely important for your glucose control, your lipid metabolism. So getting enough healthy protein throughout the day. And then in my practice, I fine-tune the carbohydrates and the fats based off advanced blood work. If you really want to know how much carbohydrates you can tolerate, highly consider doing a continuous glucose monitor for 7-14 days and see what your blood sugar does with different meals. Then you'll be able to know what kind of carbohydrate load you can tolerate. And then there's blood work you can do to see how your body's absorbing the fats that you're currently getting in your diet, and then you can decide if you need to modulate that. Because some people, if they switch to like a high-fat keto diet, they'll hyper-absorb the different sterols in their gut, and their cholesterol panel is going to go through the roof. And their doctor's going to look at them and potentially think they got FH, or familial hyperlipidemia syndrome, and they're going to be very concerned and potentially start offering prescription medications. But if you can do some advanced blood testing, you can actually see that it's an issue with the way that their body's hyper-absorbing the sterols. So that happens in 1 in 5 people. That's why you're not going to see me on here saying that there's a perfect diet for anybody without knowing some more information about them. If you're a hyper-absorber of sterols, then a high-fat keto diet is not going to be for you, unless potentially you're on a medication called ezetimibe to block this one gate, this NEMA1 PIC-like receptor. well, we'll wait for another minute or two, see if anything else pops up. But next week, I'm going to do a kind of viewer's choice. Maybe I'll put up a poll, give you top 4 choices, or maybe I'll just open up completely. Whatever gets the most votes will be the topic next Monday night. And then the following Monday, 6 p.m. Central Time, we'll go back to kind of a biohacking topic. I'm probably going to do a photomodulation one. It's been a little bit while since I've talked about red light therapy. I'll talk about how I'm currently using it at my practice and what I'm doing for my own personal health with red light therapy. So somebody's asking me, is there a place for statins in my opinion? This person's cardiologist really wants them to start one due to a calcium score of 90 and high cholesterol. So as I tell patients in my practice, statins are tools, and use the right tool for the right patient. So I'm not a believer that statins are complete poison, nobody should take them, and I don't believe statins should be in the water and everybody should take them. Statins, irrespective of what your beliefs are best used in people who are high risk. So the best data on them are for people who've already had an event, they've already had a heart attack, they've already had a stent, they already have a bypass surgery, they've already had a stroke. Statins in those instances are used to reduce events. Yes, statins are going to lower cholesterol, but the other benefits is it stabilizes plaque, prevents those soft vulnerable plaques from rupturing and causing a clot in the artery, which would lead to a heart attack or stroke depending on which artery is blocked. Statins help with endothelial function. It helps boost nitric oxide. Statins help thin the blood in ways. So there's a lot of other benefits of statins, so I'd have to know more to say, is it, absolutely right for your case? Advanced blood work would give a better idea. You want to know what your ApoB number is, or your LDL particle number. High cholesterol doesn't really predict risk very well. Cholesterol is just cargo inside the lipoproteins. Now the calcium score tested 90. Ideally, your score should be 0, but it does also depend on your age. 6 out of 10 people who have a calcium score test done after the age of 40 are going to have an abnormal score. The higher the calcium score, the higher the risk. Over 400 is a high-risk study. Over 1,000 is a very high-risk study. Over 1,000, you got over a 50-50 shot that you have a 70% blockage in your artery, and you're going to end up with a stent or bypass surgery. So a score of 90 is not high risk. Even the traditional guidelines will say that, if the calcium score is less than 400, statin should be a discussion. If it's over 400, unless there's a strong indication not to consider, statin should potentially be utilized in that individual. So statins use the right tool for the right job. It gets much more complicated. I've done, lipids 101, lipids 102. I have a couple hours of lipid talks on my IG feed and my YouTube channel. If you want to, nerd out and fall way down the rabbit hole on that. But there's different statins. Some are water soluble, some are fat soluble, some are tolerated better than others. There's certain genes people can check to see if they're likely to tolerate one statin over the other. People who've had previous myalgias or muscle pains, often it's their thyroid's underactive, they have low vitamin D, their CoQ10 levels are low, their ApoE gene is a 4. There's a lot of genes you can check. SLCL1B1, you can check that gene and determine, if a certain statin is more likely to cause a problem. So there's no blanket statement. Statins shouldn't be in the water for everybody, and statins aren't complete poison for everybody. Use the right tool for the job. So somebody asking me a question on thoughts on sauna therapy or red light therapy. So earlier I was saying that I just did a talk for the Quantum Health TV gang all about red light therapy and heart health. Fascinating trials that show smaller heart attacks, pilot studies, but smaller sized heart attacks in people who were treated for red light therapy at the time of their heart attack, activating stem cells with the red light therapy. So big proponent of red light therapy. I have a website, redlightdoc.com, that has multiple of my videos and some of my thoughts on red light therapy. Also have a video on there, is sauna the same thing as red light therapy? Because I sometimes get that question. But big believer in sauna therapy, especially for people who have endothelial dysfunction or high blood pressure. Talk to your doctor, if you've never done it before, you got to kind of start slow and work your way up for the heat. Both, forms of infrared saunas and the finished saunas, both can work. But you just want to be able to have a kind of a nice rolling sweat for 20 minutes or so. Ideally, get at least 3 sessions a week. That's been studied fairly comprehensively in Japan, where they use sonotherapy routinely for patients with cardiovascular diseases. But be mindful, gotta stay well hydrated, and if you're on blood pressure medications, make sure you're under the care of a well-trained healthcare provider who knows that you're going to do that, because high heat is going to vasodilate you, it's going to lower your blood pressure. So just be careful, with the saunas, but saunas are extremely health beneficial. Yeah, this is a great question. So, what age do I recommend healthy women get screened for heart disease? I don't see any guidance out there like there are for cancer screenings. I think that's going to start to be changing. There's, typically women are going to develop heart disease about 10 years later than men because of the beneficial effects of estrogen. But, atherosclerosis generally starts in your teens and 20s and doesn't become clinically relevant until you're in your 30s, 40s, 50s, 60s. So, ideally, people would be, screened in their teens and 20s, but, I would say starting at 40, it's very reasonable. If you're determined to be very low risk, okay, then continue to work with your primary care physician and, stay, on a healthy nutrition plan, whatever that means for you. Stay on a healthy exercise regimen, focus on your stress, focus on getting high quality sleep, and then maybe once a year you check in with, a physician who really understands endothelial health. So after the age of 40, I usually recommend women consider a CT coronary calcium score. Tell them it's like a mammogram for the heart. If you have calcium in your arteries, you're already late to the game. You're much higher risk because you should not at age 40 have calcium in your arteries. There's a newer test coming online, or I should say it's already online, but it's not available in every city yet, called the Cleerly CCTA, cardiac CT angiogram. I did talk about this 2-3 weeks ago. It's a specialized CT that uses contrast, but then also gives you the total plaque volume in your artery wall. They've recently released a paper that has a staging system, that has if you're low risk, moderate risk, high risk, based off that total plaque volume. So it's going to be much more like cancer staging. So a big believer that men and women both need to be screened earlier than they typically recommend by most guidelines. Many times you're not recommending men to get checked until they're 45 and women until they're 55. That's, in my mind, a little bit too late to the game. So if you're watching my channel, you already know I'm big into health optimization and longevity, so start early. So somebody's saying that they have some peripheral neuropathy in the legs and feet caused by endothelial dysfunction and the body not producing enough nitric oxide. Is there a simple fix to help boost nitric oxide? So peripheral neuropathy can be complicated. So sometimes it's a pins and needle sensation. Sometimes there's a complete lack of sensation. Most common in diabetics. Peripheral neuropathy tends to be in people who have, this from where the quantum biology nerds, people who have low redox. Their mitochondria don't make enough energy, and it's going to be the nerves furthest from the brain and heart that are going to have the problems, so fingertips and toes. So I'd recommend getting yourself outside, skin in the game. So your body's a solar panel, so you need to soak up some sun rays to do that. There's an app, D-Minder Pro. Also the Circadian app can help you know what time of day to be outside to optimize your sun exposure. Somebody with peripheral neuropathy, make sure you see what you're standing on, but barefoot to the earth would be key. You want to be doing a lot of earthing and grounding to get that negative charge from the earth to help balance out some of the peripheral neuropathy symptoms. But nitric oxide, I said earlier, it's a short-lived substance. It's in multiple places in the body, but from the cardiovascular standpoint, it's in the endothelium, it's in that coating of the artery wall. So being outside in the sun, the UVA light hits your skin, will liberate nitric oxide. Exercise helps with it as the blood flows past this endothelial glycocalyx, that gel coat will stimulate the endothelium to release nitric oxide. Green leafy vegetables and beets will have nitrates in them. You need healthy bacteria in your saliva, healthy stomach acid to ultimately convert into nitric oxide. So that's the lifestyle ways to do it. Yes, there are some supplements that can help boost nitric oxide, but I need to know more personalized details, and I can't prescribed medications or supplements over the internet like this. So if you're interested in more of a deep dive, just send me a direct message or check out my website, drtwyman.com. Do offer 15-minute free consultations if you want to know more about our practice, if we're right for you. But nitric oxide, very important compound. I said that earlier from one person's question. It was the number one tip to keep your arteries healthy is keep healthy nitric oxide levels. Somebody's asking the best way to reduce the risk of blood clots. Stay physically active, stay connected to the earth. So blood clots happen when the red blood cells clump together, when platelets clump together, when some people have a certain genetic abnormality where their blood has certain coagulation factors that are at higher concentrations than others. So it really depends on you if you're just saying in general risk of blood clots or you've already had one. Would be determined, should you be on antiplatelet agents, should you be on an anticoagulant such as warfarin or one of the novel oral anticoagulants. But being connected to the earth, barefoot outside helps improve the rouleau formation. It keeps the red blood cells from sticking together. So that would be optimal. Somebody's asking my thoughts on bioidentical hormones such as estrogen cream. Not opposed to it, as long as you don't have a family history or personal history of breast cancer. I don't personally prescribe hormone replacement therapy, but work with many women and men who are on bioidentical hormones. I would say it is one of those cases where it is best to work with somebody who's a professional at this and will routinely monitor your blood work while you're on hormone therapy, because it is often like Goldilocks. If you have too much, there can be problems. So not opposed to it, but just be monitored. Somebody's asking, what would I recommend to somebody with high cholesterol and ApoE34 gene? So I can't give you specific medical advice, but this is something that I will see routinely in practice. So I did a talk on ApoE a few months ago, so you might want to check that talk out. But ApoE, you get one copy from your mom, you get one copy from your dad. The 3 gene is normal. So most people, 60% of people will have a 3 and a 3. The people who have the 4 tend to hyperproduce cholesterol, so they'll tend to have higher resting cholesterol levels, higher levels of ApoB. The 4s tend to have higher risk of insulin resistance, prediabetes, diabetes, higher risk of Alzheimer's, which is basically diabetes type 3 of the brain. The 4s tend not to tolerate super high fat diets. Now, what percentage of fat from your diet can be tolerated? It's individualized because there's other SNPs that can have an effect on it. And the 4s tend not to tolerate the highest doses of statins. They may tolerate some of the water-soluble statins at the low to moderate doses. So it is one of those cases too where I want to know what the health of the arteries are. So doing the nitric oxide testing for the arteries, looking at max pulse for the pulse wave velocity, looking at a carotid scan to look at the intima thickening, looking at a calcium score test. Do you have hard plaque in the arteries? If you have advanced atherosclerosis, then you need to be more aggressive with treatment options. But ApoE34 is not a death sentence. It's not a automatic, you're getting heart disease, you're getting Alzheimer's. It's a risk factor. You just need to be more mindful of that, and you may need to do more from a lifestyle standpoint than somebody who has an ApoE3. So somebody's asking how to naturally reduce high blood pressure. For the most part, it comes down to nitric oxide. Now, there are some other reasons why blood pressure may be elevated, but blood pressure elevations is not a disease. It's a side effect of something being abnormal in your environment. So you got to do the deep dive and figure out what is broken in your environment that's driving it up. So the other case is you need to make sure you truly have high blood pressure. So if you're using a blood pressure cuff that's on your wrist, it's often going to be inaccurate. It's going to read your blood pressure too high. You need to have a proper blood pressure cuff on your bicep that fits your bicep. You need to be resting for a few minutes before you check it. Feet on the ground, back supported, no caffeine, no alcohol in the system, no nicotine in the system for a few hours, and sit down and check your pressure. That's going to be more accurate. If you're running around and you're hopped up on caffeine from breakfast, your blood pressure is always going to be a little bit higher. So first, you got to make sure you truly have high blood pressure. And the kind of gold standard way to know that is there's a device called the 24-hour ambulatory blood pressure monitor. That will give you an average blood pressure throughout the day, and especially look at your blood pressure, is it high at night? Because that is really key to stroke and heart attack risk. But back to your question, how do you naturally reduce it? Majority of it's lifestyle. How do you deal with your stress? Are you sleeping well? If you don't sleep well, do you have sleep apnea? You'll have to get your sleep apnea assessed and treated potentially. What is your nutrition regimen? Are you getting a decent amount of magnesium in your diet? Are you getting a decent amount of potassium in your diet? That's mostly vegetables. Then exercise. Exercise stimulates nitric oxide production, and nitric oxide helps with blood pressure lowering. So all the things that help endothelial health by boosting nitric oxide are the same things that help blood pressure support. The least invasive cardiac test to check heart health. So all the tests out from my office are non-invasive. I was trained as an invasive cardiologist. It was almost 10 years to the day that I finished my cardiovascular fellowship, 3 years of training doing heart catheterizations and procedures to patients who were very sick and having multiple events. But a couple years ago decided I wanted to focus way upstream and help the people not get that far. So I don't offer any invasive cardiac test at this time. There's kind of a pathway that I kind of look at patients. Start with endothelial function. You can do salivary nitric oxide. It's like a litmus paper test. The max pulse is like a pulse oximeter probe, 3 minutes long. The EndoPAD's a 15-minute test, which uses blood pressure cuffs. Tells you how much nitric oxide your arteries can make when they're under stress. Carotid ultrasound, no radiation. Calcium score test, no IV, it's a low dose radiation. CT, the Cleerly scan does require an IV, so that is minimally invasive, but that test is not necessarily for everybody, and that'd be a one-on-one conversation. But non-invasive test, there's multiple, and you want to kind of know, is it at the early stages where it's just endothelial dysfunction, or are you later in the game where you're starting to develop soft plaque or even hard plaque in your arteries? Great questions, guys. All right, well, we're coming up to the bottom of the hour, and I usually try to keep it at 30 minutes to respect your guys' time. I appreciate your time and attention. Excellent questions tonight. Again, tomorrow I'm going to give a talk on some of these tests that I was talking about, the max pulse, the Accor, the carotid scan, the calcium scan, the Cleerly scan. If you're interested in that, I'll put a link in my story after this IG Live goes up there. Next Monday night, 6 p.m. Central Time, going to do a kind of viewer's choice. Maybe I'll put up a poll, or maybe I'll just open it up to whatever topic you guys want me to hit upon. Ideally, it's going to be something cardiovascular in nature, or if you want to do, something biohacking in nature, blue blockers, red light therapy, something else, happy to talk about that as well. So, hope you guys have a great week, and if you need anything in the interim, you know where to find me. Take care.